Hi, I'm Megan, and welcome to Girl Talk. In this episode of our journey through pregnancy, we're bringing you through the exciting third trimester, a crucial time as you prepare for the arrival of your little one. We'll be covering key warning signs to look for, some essential do's and don'ts, as well as tackling some common "is it normal to?" questions. Once again, we have Prof Manisha, who's steering the ship and guiding us through this journey, and we're happy to have her once again to, answer a few common questions that any expectant mom might have during this time. So in that case, we'll jump straight into it. I'd like to welcome Prof Manisha once again. So, Prof, now that we are entering the third trimester, what is the most important thing that moms should be looking out for?
Yeah, so there are a few questions that we always ask, in beginning, usually third trimester.
Yeah.
So those include baby movements, whether the mom has enough movements or not, because less movements are not good.
Right.
Active baby is a healthy baby.
Right.
So that's one thing. Any unusual abdominal pain.
I see.
Especially the pain that comes and goes, and the pain that doesn't get better on rest and seems to be getting, worse.
Right.
So, because what we are worried about is preterm labor.
I see.
Okay. Then any bleeding. So bleeding is not normal.
Yeah.
And, in early, unless, sometimes just before labor, you can have a little bit of what we call a show, but bleeding in general is not normal. And then lastly, any watery discharge. What we are worried about there is any leaking of or leakage of amniotic fluid.
Right.
Okay. So these are the four questions that we would always ask, and these are essentially the four red flag signs that less movements, any bleeding, any leaking of fluid, or pain.
Yeah,
or contractions.
I see. Okay. So thank you for that great outline, Prof. I guess sort of diving into the meat of things now. We were talking about this whole idea of watery discharge and amniotic fluid. Could you tell us about maybe the importance of that fluid? What's the purpose of it?
So the amniotic fluid is essentially the baby floats in amniotic fluid, baby breathes the amniotic fluid. It helps the lungs to develop, their muscles, because they move their arms and legs, so their muscles to develop. Right. It's a sign, if the amniotic fluid is normal amount, then it's a sign that the pregnancy and the placenta are working well.
Right.
And things are going right. If there's less amniotic fluid, then there is a concern that why is the amniotic fluid less? Could it be that less is forming?
Right.
Or could it be that there is a breach in the membranes and there's maybe a leakage of amniotic fluid unknown to the mother?
Right.
So these are, because they both have implications, both conditions.
Okay.
Usually less amniotic fluid may be associated with, placenta that's not functioning so well. Right. And sometimes that's also associated with the small baby, or what we call as intrauterine growth restriction.
Right.
Then, of course, if there is less amniotic fluid, the first question would be, are you having any watery discharge? Because sometimes women may not be aware, and there may be small hole in the membranes through which the fluid is leaking.
Right.
They would expect, if water bag goes like in the cinema, on the movies, that there'll be a big puddle of the fluid. It doesn't usually happen.
I see.
Sometimes it's just a little trickle, and it's more like a discharge.
Right.
But the underwear feels damp.
Okay.
And so that's one thing that they should be also aware of, because if the water bag has a breach, then there's a risk of infection to the baby and risk of labor coming early.
Right.
So it's important for them to consult their doctor.
I see. So what I'm hearing is essentially that there's two things. First of all, whether it's leaking. Second of all, whether it's enough. So maybe reduced production.
Yes.
Is there a way then for ladies who are experiencing this reduced production of fluids to do anything to improve the production, to make it enough?
That's a difficult question. Usually it's very difficult. I mean, obviously, if there are no risk factors leading to that, then there's not much that can be done, because it's a physiological process, whether the placenta works well or not. But, it's obviously we have to make sure that the women are drinking enough water, they're getting enough rest, they lie on, when they rest on the left side, etc. But by and large, if the amniotic fluid is less is forming, if the baby is normal, then it's usually related to the placental function, of which there is not much control.
Right, I see. Moving away now from this whole idea of amniotic fluid, there was some talk that you had about bleeding.
Yes.
And some things about show.
Yes.
Could you tell us a little bit more about show versus what is normal, what is abnormal?
So show we start with show first. Show is actually associated with early labor, and it is usually a little bit of bleeding mixed with mucus.
Right.
So it's not a huge amount. Whereas bleeding per se is usually red blood,
I see.
which may or may not be associated with clots and/or pain.
Right.
So when that happens, that's not normal. Okay. If the women cannot differentiate between the two, then it's best to again visit the emergency center to get checked and not even wait for next morning. Okay, because this is a red flag sign.
I see. Okay, sure. And now moving to the next red flag that you were talking about, this whole idea of fetal movements.
Yes.
So that's something that we covered in our previous episode of the second trimester, this concept of counting to 10,
Yes.
which then allows us to skip over to the next part, which is basically the sense of abdominal pain.
Yes.
Could you maybe tell us the difference between, so because there are many different types of pain that can happen in the tummy, what is primarily the concern in pregnancy? It would be labor pains versus things like practice contractions, also known as like Braxton Hicks contractions.
Yeah.
How would that differ?
So usually that's a very, I think that demands a few minutes. Labor is painful. Usually the contractions begin with a wave. So they come in waves. That is, there would be pain, then there'd be a lull or a gap, and then another episode of pain.
Right.
And then, so on and so forth. So gradually the intensity as well as the interval between the contractions. So intensity would increase and the interval would become shorter.
Right.
And when that happens, and usually we will tell them that, if they are full term, then it may be labor, and they have to come once the contractions are regular, every maybe 10 to 15 minutes apart.
Right.
Or as long as the baby is moving well, as long as there is no bleeding, and as long as there's no leakage of water.
Right.
All these things being okay, it's okay to wait it out until the contractions are more regular.
I see.
Okay. Or, of course, if they need pain relief, then they have to come in.
Yeah.
Okay. Or if they're not sure, it's just one visit to the hospital. They'll be sent home if everything's fine.
I see.
So that's important.
Sure. I mean, that's certainly something we would cover in our very last episode as well, with regards to labor and all things delivery.
What is also important is that sometimes there are some serious conditions that can be associated with pain, which are actually dangerous for the mom as well as for the baby.
Right.
One of these is called placental abruption,
Right.
where the placenta may start separating prematurely, and that pain is constant.
Okay.
It doesn't come and go,
Right.
and is usually associated with bleeding, and that should, that's a major red flag.
Yes.
That demands immediate,
An emergent
correct,
reporting
visit
to the hospital. Right. Okay. So thank you for that. And now, after we've covered the key warning signs, just talking about a few things of is it normal to experience it during this time?
Sure.
Some people might report things like feeling morning sickness again and some nausea and vomiting in the third trimester.
Yeah, so a small proportion of women do see recurrence of nausea, vomiting of pregnancy in the third trimester, but usually majority don't.
I see.
However, the treatment remains the same. In fact, in third trimester, we have more options in terms of medications that we can give them.
I see.
Most of the time, they just need reassurance.
I see.
That it's okay.
Sure. And in addition to that, there's also some talk about sometimes having this thing called colostrum.
Yes.
Do you mind explaining that to us a little bit?
So in the, body is now getting ready for labor, for baby coming. That means, preparation for breastfeeding and all that.
Right.
So breast is also getting ready, and the hormones are, also getting ready as well too. So it doesn't happen overnight. It's not like a tap that opens and milk pours out.
Right.
So just in the last few weeks of pregnancy, women might notice some changes in their breasts. So there is pigmentation, there are, size becomes bigger, but there may also be some clear or milky white discharge.
Right.
So it is normal to experience that. Yeah.
I see. Thanks, Prof.
And that's colostrum. There's one more thing I just wanted to mention,
Sure.
and that was, we screen for group B Streptococcus.
Yes.
That is around week 35 to 37.
Right.
And that is a bacteria that some women carry in their vagina, and it's not harmful for the mum, but from the baby's point of view, mums that are positive for group B Streptococcus or GBS will be needing some antibiotics in
Right.
labor. They cannot change whether they are positive or negative, because that's how we all carry millions of bacteria everywhere in our body, and Similarly for the vagina.
Right.
So we can't control what we carry, but we need to know as obstetricians so that we can, prevent the transmission of this infection to the baby for mothers who are carriers.
Right.
And it can easily be done by very simple antibiotics.
Right. So once again, sort of this prevention is key kind of idea.
Correct. Yeah.
That's very nice. And so, Prof, actually that brings us very nicely into our next segment about some significant milestones to sort of encounter in the third trimester. Obviously, one of them would be what you mentioned earlier, the testing for the group B strep, which is just a very simple sort of swab test of the vagina.
Yeah.
Another sort of thing that people like to discuss is things about the baby's positioning during this time, because it seems very permanent once the baby reaches a certain point. Could you tell us a bit more about baby positioning during this time?
Yeah, so most babies stabilize their lie, meaning their position, in around week 36, 37.
Right.
Majority of babies will present with the head presenting, that is what we call a cephalic presentation, that is head is low, okay, just above the pelvic brim. A small proportion of babies may not be in that position.
Right.
So when the baby's bum is down and the head is on top, it's called breech presentation. And when the baby lies across the tummy, mother's tummy, that is called a transverse lie. So these are not normal, and there are concerns, especially about breech, which is more common than transverse lie, because there was this large study that showed that it's not safe to deliver the babies in breech position because the baby's head is the bigger part.
Yes.
If the smaller part, that is the breech, comes first, then there's sometimes a small chance that the head can get stuck.
Right.
And if there's delay in the delivery of the baby's head, then that can cause problems for the baby in terms of lack of oxygen, leading to some, brain damage, etc. Just two options: if the baby is in a persistent breech position after 37 weeks.
Right.
So one would be to go for a planned C-section. That's called elective cesarean section, which is usually done, week 38 or week 39.
Right.
Or the second option would be to try to turn the baby.
Okay.
What we call in medical terms as external cephalic version.
Right.
Meaning we try to turn the baby or manipulate the baby into the cephalic presentation using our hands. That's usually done in the delivery suite,
right,
after a certain preparations, and maybe so we use some medications to relax the muscles,
right,
to aid or facilitate the procedure.
Right.
But not all women want to go through that because there may be sometimes some risks attached to it.
Yep.
And also they are scared or worried. So, ultimately it boils down to what they are comfortable with and, whether the amniotic fluid is enough and how big is the baby.
I see.
According to that, we give the chance of success, which is about 50% for successfully turning the baby and preventing a C-section.
I see. So thank you so much for all of that information, Prof. I guess to sort of summarize it all together, within the third trimester, what is one piece of advice you would have to mothers who are about to deliver?
So I think one is to get organized. So I would say around week maybe 35, 36, they should start packing their bags.
Right.
Which would include not just things for mom and baby, but also the relevant documents that might be necessary in the hospital. They could go to the hospital and go do their financial counseling so that they are better prepared. They know what to expect and they can plan. And then they should also be mindful of, the 4 red flag signs that we mentioned.
Right.
That that is the time to come to the hospital.
Right.
And make sure your husband is around and his phone is charged.
Definitely. So this is really where sort of the early planning really comes into play and definitely helps someone through this.
Yeah.
Right. So thank you, Prof, again for coming by and for all the information that you've given us.
Sure.
We've covered sort of the important things to look out for in the third trimester, some normal things to experience, as well as some important milestones that people normally cross during this time. Once again, if you've missed our previous episodes on trimester 1 and 2, feel free to check out those out on our YouTube channel and look forward to our next episode, which will cover everything related to deliveries, and that'll be our final episode of this journey through pregnancy. Thank you very much, and once again, this is Megan from the Girl Talk podcast. Hi, thanks for watching this episode of Girl Talk. If you enjoyed it, feel free to like, subscribe, favorite, and follow Girl Talk on all our social media platforms. We hope to see you on our next episode.